Good afternoon. Thank you very much for joining us this afternoon for today's press conference. Before starting, I need to do a little administrative work. We are also live streaming this press conference, and the public can and is joining us through our Clinton County Health Department's Facebook page. I would add to those of you joining us via the live stream that since we anticipate duplicate questions on the same topic, please listen carefully, as the information you are seeking may be answered in the prepared remarks or as part of a response in a combination of questions. A closed caption recording of this press conference will be available on Clinton County Health Department's YouTube channel later today. We shall now get to the task at hand. My name is Mark Henry. I am chairman of the Clinton County Legislature. I will be joined today by Director John Kanoza of the Clinton County Health Department, Dr. Keith Collins from the University of Vermont Healthcare, CVPH, and Dr. Wouter Rietsema. Dr. Collins is an infectious disease specialist, and Dr. Rietsema is vice president of CVPH. Our purpose here today is to bring you and the public up to date on the effects COVID is having on our county and on our region, and how Clinton County is responding. I had some statistics given to me today. At this time, or on December 18th of 2020, at this time, we had 101 active COVID cases in our county. On December 18th of 2021, we have 304 active cases in this county. On December 18th of 2020, we had a positivity per 100,000, a 7-day average per 100,000 of 3.3%. On December 18th of 2021, we have a 7-day average positive of 7.3%. 35% of the total deaths from COVID have occurred since September 1st. So 18 of 52 total deaths in our county have occurred since September 1st. Therefore, based on these numbers, and also on the important information that will later be provided by Director Kanoza, Dr. Collins, and Dr. Rietsema, Clinton County and other North Country leaders from Jefferson, Lewis, St. Lawrence, Franklin, Essex, and Hamilton counties, acting in concert, have already or will today be declaring a state of emergency in all of these North Country counties. It is important to note here that Clinton County was one of only 4 counties in New York State that did not rescind its original state of emergency from a year ago. We kept those states of emergency in place and have been extending them every month since. We felt that by doing that, it provided a good underpinning for what might lie ahead. The purpose of our re-extending our current state of emergency is to continue to allow Clinton County those additional powers that might be needed to respond adequately to a given disaster or public health crisis so that we might protect life, health, property, and provide emergency assistance. It also permits local municipalities to obtain assistance from both the state and federal governments. To repeat, this is now being done in all of our North Country counties. This is important as we believe that it will serve to bring attention to the issues at hand, and the region-wide action may be much more effective than each county acting separately. However, this is the ability for counties to act separately is still preserved. In addition to this region-wide state of emergency, county leaders have also called upon New York State for a number of initiatives and resources. New York State and county leaders have reinstituted weekly briefing calls, which will provide a direct forum with New York State leadership to discuss mutual issues as they happen. In these calls and other forums, we have stressed the need for rapid PCR tests for nursing homes, schools, residents, and the community at large. We have asked New York State for expanded vaccination and testing sites. to include mass vaccination and testing. Vaccination and testing is a key component to all of this. We have taken advantage of New York State's offer to send National Guard to assist us, and we have already received 2 National Guard personnel to assist us at our nursing home. To provide a more granular context and background to this issue, I will call upon Director Kanoza and Drs. Collins and Rietsema to speak. I would call upon Director Kanoza to speak first. John?
Thank you, Mr. Chairman. Welcome, everyone, again. Thank you for joining us today. I can't extend my appreciation to all of you enough. As most of you know, my name is John Kanoza, and I'm the Director of Public Health here at the Clinton County Health Department. As of this morning, we currently have 304 individuals in isolation. These are all active cases, current active cases, that is, while we also have 524 individuals in quarantine, those being close or approximate contacts of a person who has tested positive for COVID-19. Since March of 2020, when all this started, we have had a total of 8,339 COVID-19 related cases and 52 deaths due to COVID-19. Many of you have noticed that the number of active cases that we are seeing lately is above the 300 mark. As Mark Henry, Chairman, Clinton County Legislator, indicated, to put things into perspective, as he indicated, on December 8th of last year, we had a total of only 101 active cases. As always, our staff at the CCHD Health Department continue to work very diligently on contact tracing and case management. However, as I know, as you all likely know, contact tracing efforts alone will not be enough to minimize the spread of COVID-19 in our community. We are asking residents to continue to follow, as we always have, the same safety practices that have proven effective in the fight against COVID-19. Those including mask wearing, physical distancing, hand washing, avoiding crowds, avoiding high-risk activities, and also staying home if you are feeling sick or under the weather. We are also asking residents to monitor their own health very closely. Our staff have noticed through our communications with the public that a very high number of COVID-19 cases reported that they had normal cold symptoms and therefore delayed testing or thought nothing of it. For many of us, the symptoms of COVID-19 can seem just like a cold. But for those members of our public who are most vulnerable, residents who are immune compromised, older adults, and those who are not vaccinated, symptoms can be much more severe and require hospitalization. Seeking testing immediately upon feeling ill, no matter how mild, and self-isolating while awaiting those testing results is extremely important in reducing the spread of COVID in our community right now. If you are feeling sick or even just under the weather, please do not gather with friends or family members. Stay home, stay separate from family members, contact your primary care provider, and seek testing. Better to know early during the illness than wait. Don't wait. Seek testing. With the holiday season approaching, CCHD recommends residents please limit gatherings to the members of their immediate household only. Residents who fall in one or more of the at-risk or higher risk categories for severe illness should consider staying home. It is never, as we know, it is never the intention of family members to be the cause of COVID-19 exposures. However, it is one of the more common sources we have found for known exposures occurring in our community at this time, especially with the highly contagious Delta variant pervasive in our county as much of the North Country. Lastly, and this is my big ask to all of you, if you have not been vaccinated or have not received a vaccine booster, now is the time to do that. Getting vaccinated will reduce your chances of contracting the virus, reduce the risk of severe illness and death, and will help contribute to the overall immunity to COVID-19 in our community. Information on vaccination opportunities in Clinton County can be found on our website, www.clintonhealth, all one word, .org. That's www.clintonhealth.org. I will now turn it over to our next speaker, Dr. Keith Collins, infectious disease specialist at CVPH. Thank you.
Thank you, John, and thank you guys for giving me the opportunity to go through a little bit of the clinical information we have about Omicron, which is what I'll talk about mostly. But I will, just before I talk about Omicron, I want to say that actually the thing I still worry about the most right now is what's going on with Delta. Delta really, we know, makes people sick. We know people get hospitalized. We know people die. And we actually know now that if you are unvaccinated with COVID, you are 14 times more likely to die from COVID than if you had been vaccinated. So I can't echo enough for what John just said, is that if you want to stop this pandemic, if you want to stop it, you've got to get vaccinated. That is the only way we're going to stop the pandemic. And that includes, here in Clinton County, that includes South Africa, where the new variant came through. They only had about a 10% vaccination rate, and that's ideal for the virus to mutate. So with that, I just want to say, I can't say enough, more than anything else, to stop this pandemic is for everybody to get vaccinated. Now, to give you a little bit of what we know and don't know about Omicron, unfortunately, what we don't know far exceeds what we do know. That's probably going to change in the next 2 to 4 weeks, but right now we're still mostly in the dark about what this variant really means. We do know it's a variant that has more mutations than any of the other variants we've seen so far. There's several theories about why this variant has so many. I won't go into that, but what we do know is that some of the mutations it does have is likely to make it more contagious, and preliminary evidence that we're seeing from Southern Africa looks like it is more contagious. Now, again, that's preliminary. So for assuming for the moment that it is more contagious, that just makes getting vaccinated and doing all the things John just talked about more important than ever. What we also don't yet know, and I think I'm still really waiting to hear, and time will tell us, is even if it is more contagious, how sick does it make someone? We just don't know that yet. It seems, I've heard conflicting things, but preliminary data, and it's very preliminary, seems to show that especially in people who are vaccinated, if they get infected, they can still get infected, but they tend to get a very mild illness. I'm hoping that it will make people less sick than Delta. That could be that would be our best case scenario. But the next 2 to 3 weeks will probably let us know that. But we just don't know yet whether it's going to make people as sick or not. But at least I'm comforted by the fact that people that have been vaccinated don't seem to be getting very sick, and that's especially true if they've gotten a booster. So with that in mind, again, I think it just points toward us really needing to get vaccinated. The other thing I wanted to talk about is how to test for, do the tests we have now that we've been using all along pick up this variant? And the answer is yes, they do, but they don't distinguish this variant from Delta. So we could have, for all I know, we could have Omicron around here. I don't think we do, but we don't have the means at our hospital or in our county, to my knowledge, to test for Omicron. I'm sure we're going to have samples sent to our state lab, and I'm sure our state lab is testing samples for Omicron. But what I do want to stress, though, even though we can't tell if it's Omicron or not, we definitely can still tell whether someone has COVID. So that we do know is that tests we have now pick up this variant. They just don't distinguish it from other variants. Another thing I just wanted to talk to you briefly about is the other thing we always are concerned about, especially at the hospital, is do the treatments we have now that we've been using for COVID potentially work against Omicron. And I think the jury, again, is still out on that. When people get to the point where they're sick enough that they're needing what we call anti-inflammatories that we've been getting, my guess is they'll work just as well, because those treatments are for people. Those treatments aren't aimed against the virus, they're aimed at the body's immune system's overactivity against the virus. I don't think those medicines should work as well. It's medicines we have that actually fight the virus itself that we just don't know yet. I don't know how many of you have heard about monoclonal antibodies. We've been using them now for a long, long time. They do work. They lower your risk at least with Delta, of getting hospitalized or dying by at least 50%. There's evidence that maybe, we just don't know yet, whether the monoclonals we have now will work against this variant, because the monoclonal antibodies, which are the synthetic antibodies that are made by the pharmaceutical companies, against the spike protein. Well, the mutations, there have been about 35 mutations in the spike protein now. We don't know whether the monoclonal antibodies we have right now will work against that particular variant. But again, that's not the end of the world just yet, because right now we're dealing with Delta, and those things do work. And if we're lucky, maybe Omicron won't make us as sick, but time again will tell. There are some other treatments that are going to be coming out that you may have heard about. There'll be pills. One of them, the FDA has, I don't think they've given approval to it yet, but they've already met about it. It's called molnupiravir. It's not going to be my favorite, but it's going to probably be the first out. It lowers your risk of being hospitalized or dying by about 30% if it's given within 5 days. There's every reason to think that that medicine would work just as well against Omicron as it would against Delta, because it doesn't target the spike protein. And the same is true of another medicine that has not yet been, the FDA hasn't met about, that I'm really excited about. It has the potential, if given within 3 to 5 days, of lowering your risk of getting hospitalized or dying from COVID by around 89%. And in fact, in the trials, nobody died that got the medicine in that time period. And there's, again, every reason to think that those medicines would work against the new variant. But as they say, an ounce of prevention is worth a pound of cure. Get vaccinated. I'm begging you again. I begged you about a year ago to get vaccinated. I'm doing it again. Our hospital has been able to keep up with it so far, but if things get much worse, our hospital is going to be in real trouble. We're going to have people once again not getting what they need, who have cancers that need to get resected, and they'll be put off because our hospital will be overrun. You can stop that by getting yourselves vaccinated. And with that, I think I'll stop and let Dr. Rietsema have a turn.
Thanks, Keith. So technology is wonderful, except my note just disappeared. So we'll work without notes. For the most part, what Keith said, get vaccinated. I think I'll start just to give a picture of where we are at CVPH right now. And it's not pretty. It hasn't been pretty since September. And maybe you all have missed that, but I tell you, anybody working at the hospital hasn't missed it. We're running, and we've been running for the last 2 months, between 30 and 50 people in the hospital at any given time due to COVID. That's a lot. We only have about 130 beds for acutely ill patients, and so when 40 of them are taken up by COVID, that's a lot. For the last, is my phone causing that? I don't know. For the last 2 months, pretty much every morning, when we come in the morning, there are anywhere from 10 to 25, or the worst case is even 30 people in our emergency room who should be admitted, but there's no room. So that's where we are. I will tell you that our staff has done an amazing job. This pandemic's been tough on everybody, but for our staff who are challenged on a daily basis, and for healthcare workers to see people die needlessly is pretty painful, especially when they put all of their efforts in to save people. And to see them die when a simple shot we're used to seeing people die from smoking, and these are long lifetime behaviors. This is a shot, or let's say 2 shots. That's all you need to do, and we wouldn't have 40 people. We wouldn't have had 13 deaths since September. So, and our teams are doing a great job, and our team is smaller than it was last August. We had already been challenged by staffing, but a combination of just people are tired. Some people have left healthcare. A combination of the vaccine mandate. The vaccine mandate clearly cost us staff. In the last 3 months, we've lost 100 people. We only have 1,800 people, so 100 people, and especially when they're in the clinical space, aides and nurses, that's a real problem. Should I be doing anything differently about that feedback?
It could be some of the other microphones, although it might
There we
be.
go. Don't know. I want to give my thanks to the entire team at the hospital because they're doing incredible work. We have been, the governor's executive order came out, and I'll talk about that in a second, but it's really, it's called the Flex and Surge State Plan. We've been flexing and surging for the last 3 months. So we've been utilizing overflow areas. We've been, as many of you may know, we went through a 3-week period in October, November, where we did not do any surgery that would result in inpatient admissions. So this flexing and surging is not terribly new to us, but I think the state is concerned. Numbers are rising with the holidays. We saw a clear surge in cases after the holiday, and that is probably over the next week going to manifest itself with more admissions to the hospital. The executive order has said that hospitals that are operating at the type of capacity that we are need to back off on non-essential procedures. So non-essential procedures is a vague term, but that's not a terrible thing. I think the type of uniform wipeout of all procedures that we did last spring, not last spring, the spring before. When we didn't know anything about COVID, I understand why we did it, but it was a sledgehammer when a scalpel would have been more useful. I think the new executive order has leeway, and we will continue to do procedures of many types where to not do them would cause significant, harm to the individual in the short run. So we do have the leeway to do that, again, within our own capacity to do that. So, we will continue to flex and surge. We will continue to manage our procedural volume. We will continue to move people around in the organization to meet the needs of our community. But we really need your help. So, and what do I mean by that? Everybody's already talked about vaccination. All of this would not be nearly as bad if folks were vaccinated. We're up around 75% of adults are vaccinated. That sounds like a big number. Well, that means 25% of adults are not, and that is still a big number in a county of 80,000 people. What have we had? 8,000 cases in the county? 8,000 cases of COVID. So that still leaves a lot of people who are A, unvaccinated, and B, have never had COVID before. That frightens me. So please get vaccinated. On a more specific note around the hospital, we need your help too. So we recently had a case where a visitor, unvaccinated, chose not to follow the screening questions at our door and chose not to wear a mask while in the room with a patient. We ended up with ill patients and ill staff. Ill staff can't work. They weren't really ill, but they can't work. So those very basic things, we need your help. If you're sick, don't come to the hospital. If you're sick, please respect our screening questions. And if you're visiting, wear the mask. Wear the mask at all times, even when you're with your loved one. I know you're with that loved one at home, but in the hospital, that loved one, if that loved one gets sick, that loved one can transmit it to other people. And that's what we saw. So we need your help. The people that work there, they're your friends, they're your brothers, they're your sisters, they're your children. They're part of this community too, and we all deserve a hospital that can take care of all of our needs. And right now, we're on the edge of being able to do that, and we need help. So, with that, that's it for my comments.
Thank you all. Thank you, John. Thank you, Dr. Collins, and thank you, Dr. Rietsema. To recap, Clinton County and our region are once again facing a severe spike in infections, hospitalizations, and indeed fatalities. Clinton County is working on every level to do all that we can to mitigate this spike. One important part of this is joining with our North Country counties in extending our declaration of emergency, as well as working with New York State to obtain needed resources, especially expanded vaccination and testing. You can help us. It is a very good idea. It is a critical idea to get vaccinated. If vaccinated, get a booster shot, wear a mask, practice social distancing. We need to ensure we stay healthy and out of the hospital, preserving the hospital's critical space and maintaining your good health are job one right now. Thank you all again, and we will open it up for questioning when you have it, to whoever you would like to ask the question of.
My first question is actually for you, Mr. Henry.
Okay,
So
yes.
I just wanted to clarify that Clinton County has been under a declaration of emergency this entire time. It's now just joint with the other North Country counties.
Yes, that's essentially correct. We have had this. We have never not had a declaration. I renew that every month. Other counties have let that lapse for their own reasons, but now other counties are reinstating their declarations of states of emergency. We are just continuing ours.
Can you talk a little bit about what those additional powers are that a declaration of emergency would allow the
Sure,
county to do?
I absolutely can. I anticipated that question. I do know what they are, but I want to be accurate in what I told you before.
Yep.
What they can do generally is give powers to the county to be able to respond to a natural disaster, or in this case, a public health emergency. Those additional powers, say in this case, could be things like mandating mask wearing across the county, mandating hours for businesses, mandating a curfew, doing those types of things. So that declaration of the state of emergency is the base from which orders of emergency can then flow. So you can issue orders based on the fact that the declaration of emergency is there. Just putting a state of emergency out there does not enact any orders unless we act to do that. Does that help you at all?
Yes, and I have a follow-up question to that. Do
Yeah.
you foresee Clinton County bringing back any of those mandates anytime soon?
Not in the short term. And again, we would not do that. Before, we had a conversation with the health department, Dr. Rietsema. We had a conversation with our legislature to gain consensus there. It is something that obviously would require further conversation. But if you're asking in the short term today if we're announcing any changes, no. We have had this declaration of state of emergency for the last year, basically. No orders have flown from that, come out of that yet.
Thank you.
You had mentioned that you did take up the state on bringing National Guardsmen to nursing homes. You said there was 2 in the county. Do you know where in the county, like at which homes they're at?
I believe they're at the county nursing home, and I think there's 2 of them, right? So
The county
2,
nursing home, yes.
and it's at the county, our county, Clinton County Nursing Home.
And could they be brought to are other nursing homes interested in that as well?
I
or-
don't know, Kara, that's a good question.
Okay.
I
I just wasn't sure if they had communicated about also.
Not with me.
bringing that home.
I don't know what the logistics of it are, if they can be moved around or others. Right now, what I do know is last night, I think it was last night, I learned anyhow, that there were 2 at our county nursing home.
And I know you had mentioned too the idea of mass vaccination sites. I know when Franklin County declared their state of emergency as well, they said that's one of the things they're really hoping for in Plattsburgh and Potsdam. Have you spoken to the state about that idea of bringing it back? Is there any movement on getting one to come back here?
The short answer is yes, several times, as well as I'm sure John has. I don't know if the doctors have, but I can tell you that's an ongoing conversation we have had due to the importance of it, as you pointed out. So we're hopeful that we will be successful in that.
Would that be for booster shots or all types of shots at a new mass vaccination site?
I think that would be for, yeah, I think so, yes.
Are you seeing the need for booster shots at this time to have a mass site open?
Yep.
Okay.
And regarding bringing back any sort of, mask wearing mandate, curfew, that kind of thing, is that something that Clinton County would be looking to move on by itself or as a region? You mentioned the conversations with the legislature and the health department, but is that something that would have a broader kind of approach?
Well, are you talking about the specific orders that would flow from?
Yes. Based on the declarations of emergency that
Yep.
you've declared, would you then, all 7 of you, seek to?
Oh, I see what you're saying, act in concert on that. That is a conversation we would have. I think that there would be a pretty good chance of that, because I think we all believe, and I don't want to speak for other county leaders, and I'm not, I'm just speaking for myself. My sense is that we all think that acting regionally has more effect than just acting one county at a time. So that would be a discussion I would certainly have. However, each county is separate and each county can do what they want. So there is no guarantee, because you've declared this, that we are all going to act in concert on one thing. I think my argument would be we should, but again, that would be up to other counties. Yes, sir.
Has there been any discussions about like any new emergency measures we haven't seen before, or is it just is there currently and I know you said there isn't any implementation currently, but are there any discussions that have happened or sort of plans or just kind of things that maybe you're considering currently but haven't acted on?
Not really, to be frank. I mean, when you talk about discussions, I think more of formal discussions, where we sit down and say, okay, we've got this problem, what can we do about it? We have talked about everything under the sun, just as like I'm sure you all have among yourselves and your friends and everybody else. What we have done today, and by we I mean the 7 counties that are involved in this, in our North Country region, have talked about some of the statistics you heard today that are even worse in other counties than they are here, as I'm sure you're well aware. And what can we do first? And we felt that what we could do first is get these declarations of states of emergency out there, and then lobby the state for vaccination and testing and those types of things, reinstitute these calls, these weekly calls that we have with state leaders, so they are aware of exactly what's going on. And then from that, see where we wind up, what other things might flow from that. But as saying, okay, we already know what the next step is, no, I don't believe that would be true.
Okay. Mark, and this is for John and doctors as well. We've seen the numbers, they're alarming. And I don't want to be a pessimist, but if people don't heed the message and get vaccinated and wear masks, how bad could it be? What are we looking at? Worst case scenario.
Well, I would certainly leave that speculation up to the experts. So either one of you.
Go ahead, Wouter.
That is so far out of my league, it's unbelievable.
Well, you do the math. We have 80,000 people in this county. From a hospitalization and death perspective, for the most part, you don't view the children as at risk. So I don't know how many children we have, maybe 10,000 children, just pick a number. So that's 70,000 people. 70% of them, or 75% of them are vaccinated. So 25% of 70,000, whatever that is vulnerable. Now, some of them are less vulnerable because they've already had COVID, but not most of them. So you still got an additional, I don't know, 12, 15,000 susceptible people running around our county. So how bad could it be? I think that's the answer.
And at what point would we see, if people don't get vaccinated, would we see the numbers go down, or would we?
So I don't think there's going to be a point. I think there's going to be, what we do see is you do see new people getting vaccinated, okay? You see people getting boosters. You know, Dr. Collins mentioned the Pfizer drug that we expect maybe in a month. That's going to make a difference. There's also some other therapies that could come out that would be available for at-risk people as a preventative, which are pretty exciting. So those things will add up, and gradually the supply, the fuel. So what's the fuel? The fuel is the unvaccinated, previously uninfected. They're the prime fuel. Gradually, that will slow down. There's not going to be a moment in time where all of a sudden this can plummet down. I mean, we watched the fall. If you look the big picture over the fall since September, we've basically been somewhere between 30 to 35 cases a day on average. Some days we go 60, some days we go 10. And then after Thanksgiving, it bumped up. I think it's going to drift back down to that 30 to 35, and then Christmas is going to come. And people are going to do what they shouldn't do, especially unvaccinated people shouldn't do, and they're going to gather in big groups. And we're going to see that. So how bad can it be? Well, it can be worse. That's why we're here.
Dr. Rietsema, do you have the numbers? I know you said about 70% of people in the county are vaccinated. Do you know the percent of people that are boosted? Do we have those kind of statistics?
No, we have a dashboard. It's actually publicly available on the internet that I can funnel out. I don't know, Molly, if you have do we have the address for that?
You can find it on the health department's webpage.
So you.
Yep, we link directly to it.
Is that the state dashboard or the one that we created for the North Country?
The North Country.
I will say with no small amount of modesty, the one that we created for the North Country, 2 data analysts, Lillian Wu and Lisa Cyphers, have created a spectacular dashboard that will give you more information about the North Country and vaccination than you will ever get from the state. So I encourage you to go there. And if you can't find that link, contact one of them and I'll send you the link. It's publicly available.
Do we know, off the top of your head, the percentage of patients hospitalized with COVID-19 right now at CVPH, how many of them aren't vaccinated?
Yeah, so we report that on a daily basis. So we're running about probably 60 to 70% are unvaccinated and the remainder are vaccinated. But doesn't tell the whole story. So if you look at the really sick ones, that number is about 90% unvaccinated. Keith?
I've only seen one in an ICU so far since the pandemic started that was unvaccinated.
That was vaccinated.
I mean, that was vaccinated, one.
So if you didn't hear that, Keith, who sees all these people, one person in our ICU who was vaccinated. And it was probably someone that had all sorts of other comorbidities and was very old.
Correct.
Right. So, I mean, a lot of the vaccinated people in our hospital are actually admitted for something else, congestive heart failure that maybe was kicked over by a mild case of COVID, because we know that mild infections can take medically tenuous people and make them ill, but they're not dying from their COVID.
I have another question. I'm not sure if this is data we have right now either, but are we seeing any breakthrough cases after people have gotten the booster shot?
It's a great question, and I haven't seen anything. Keith, have you?
No.
Thank you.
I'm boosted. I haven't broken through yet.
With breakthrough cases, do you still see the loss of smell and taste?
So,
No, you see the patients. Do you want to come up here, Keith?
I mean, that would be one way to tell if you, oh my God, I got COVID.
So most of the breakthrough infections are actually very mild, and so people you can lose taste and smell, but it's usually it's such a mild illness that people mistake it for a cold. So yes, I do think that's an important point, that even if you get COVID, if you've been vaccinated, that's really what the vaccines do best, is they don't necessarily prevent people from getting infected with COVID. They prevent you from getting sick with COVID. And that is critical. It was doing it again. So I think that's where the vaccines really do come in, is if you may get a case of COVID, but it's going to be mild and you probably won't need hospitalization. So you can get those things, but again, they're mild.
Dr. Collins, can you or Dr. Rietsema, whoever wants to chime in, can you kind of give us a refresher of how immunity from being infected from COVID stacks up from vaccine-related immunity?
Yeah. So natural immunity from people who get COVID, we think that it's probably pretty good for about 90 days, and then it looks like it starts to wane. It turns out that if you're vaccinated, you go at least, like with Pfizer, you go at least 6 months before it really starts to go down, and that's why we've had boosters. The Moderna actually goes a little bit longer than 6 months, but I think for the sake of simplicity, the FDA and CDC recommends anyone with either Pfizer or Moderna get a booster after 6 months, and with Johnson & Johnson after 2 months. But the immunity you get, at least from the antibody perspective, the amount of antibody you make after a vaccine is far better than what you get after natural immunity, and it lasts longer. That's, again, I think, really important why people get vaccinated. And vaccines don't just make antibodies. I know that's what we've talked about now for 2 years. Vaccines also do something where they stimulate something called cell-mediated immunity. And that's harder to describe really the way antibodies are, but it's probably just as important and maybe even more important to protecting people against COVID. And that is not something we can measure easily like antibodies. And my suspicion is that even people where the antibodies have waned, their cellular immunity will probably do a pretty good job for them. But again, that's more speculation on my part. I don't know that as hard science. But if it's like other illnesses, that's true for most other illnesses that are infected.
Could you comment on whether people with natural immunity benefit from vaccination?
Yeah, that's a really good, thank you, Wouter, because that's important. Yes, even if you've had COVID, it's really important to get vaccinated. We do know, even with Omicron, we definitely know people have had breakthrough infections. That's how they found it. Remember, Africa has already had Delta go through there. And a lot of the people that were getting, not sick, but people who were getting infected with Omicron were people who had already had Delta. And so what we do know, at least if we put Omicron just aside for a minute, we know that people who have had COVID and then they get vaccinated are probably the best, they get the best immunity that there is. They are called super immune, for want of a better term. And they actually did a study, at least in the test tube, that showed, aside from Omicron, which is too new, that those people seem to have good antibodies against all known strains of COVID, all of them. So my guess is maybe they're not going to be quite as good against Omicron because it's got so many mutations, but I bet you it'd still be really good. And again, preliminary, it looks like vaccines are actually also good even for Omicron, even though it's the antibody against the spike. So yes, even if you've had COVID, you should get vaccinated. And you can do it anywhere within a month to 90 days after you've had a bout of COVID. So please, anybody get yourself vaccinated. Okay.
I have a question regarding testing. With people getting sick, it's high in the community, especially if you can't tell between the symptoms, you should get tested. We've said that. Is there any plans to bring back kind of mass testing sites? I know, I believe CVPHs, you need a doctor's note in order to go to. I know that pharmacies have been busy too. Are there any plans of bringing kind of the mass testing site back, or?
So, Wouter, you may be able to speak to that better than I could. So, good question. By the way, I get cold. I'm from the South. I had to put a jacket on. Sorry.
Yeah, the testing environment, in my mind, I said this on a call we had about testing in the region. Where we are as a country, where we are as a state with testing, 20 months into the pandemic is completely unacceptable, right? So it's unacceptable. So CVPH, once the state pulled out, and granted, when the state had a mass testing site, it was CVPH that ran the site. The state just paid for the testing, which is no small thing. So once CVPH started running the testing, we can't afford to pay for the testing, so it has to be billed to insurance companies. That requires a doctor's order. So if the state were to come back at us with a contract such that we could get testing through a state-paid resource, we would figure out how to do that. But we really need testing resources. I mean, where we are with testing right now, from a infrastructure point of view, 20 months into this pandemic is dreadful. Period. It's dreadful. Other countries have widely available at-home testing. We don't. And anyway, I won't go on anymore because I get really upset about it.
Anything further before we call this to an end? Karen, you have?
On that note, I was wondering, John, can you speak to how the school testing is going that the county has been working, through BOCES?
Sure.
You had asked about the school testing, how it's proceeding steadily, a little bit slow, but the schools are now equipped and/or have been trained and ready to start testing all symptomatic students or staff that do come to the nurse's office for that. Since end of September, they have been testing asymptomatics on a regular basis just to keep going through the population. For two reasons. One, to just get a general assessment, evaluation of those that might be in the population positive without being symptomatic, and also to get good at the processing of sampling for testing and testing with laboratories. So it's proceeding. It's every week that goes by, the school systems and CVES, who is the lead, we're working with them. They are the lead in this. Randy Lozier with CVES is leading up that work very well, and they get better every week. So it's moving right along. It's helping.
Yeah.
Mhm.
It's my understanding that it had to come with, parental guardian consent.
That's-
Did
yes.
a significant portion
Yes.
Consent, or
Yes.
have there been struggles with that?
Yes, it's not been easy. There are so many little connecting items that need to be accomplished when you move through this, including parental consent. It makes it a bit cumbersome. And they've been working through that, and they're doing, like I said, better every week, every month at doing more tests, and hopefully we can take the burden off of CVPH's testing site, where a lot of parents have been bringing their kids for testing, and the schools can exclusively be doing their own testing, or at least for the majority of the tests that need to be done for children in schools, students, the schools can be accomplishing that. That is the ideal goal of this, of the grant, the state DOH ELC school testing grant and the program. So, okay.
Okay. Very good. Thank you all. Thank you for attending. We appreciate your interest. I want to thank everyone for coming. I know some of this has been last minute. I know John came in off vacation, so that was nice of John. Again, thank you. This will conclude, and obviously we'll be around. You know how to find us. Thank you.
Thank you for doing this.
Thanks.
And, we'll see you next week.